The following is a paid promotional announcement for Dunes LASIK Center in Dakota Dunes. Dunes LASIK Center provides safe, painless, and affordable vision correction.
There's so much I could say.
So I tell people, they're like, how's it been post-surgery? And I'm just like, quality of life's better this way and this way and this way.
Go for it. It will change your life.
LASIK is a gentle reshaping of the surface of the eye that changes how the eye focuses.
A typical LASIK procedure includes two different lasers. The first laser creates a flap. The second laser then gently reshapes the cornea to correct your glasses prescription.
The flap is then put back in position. The eye heals rapidly. Within 4 to 6 hours, the first stage of healing occurs, and the corneal nerves are starting to help heal the tissue back together. And you might have like a little bit of discomfort, but you can miss that because most of our patients, we encourage them to take a nap. They sleep through it, they wake up, their eyes feeling pretty good. And it's pretty remarkable to think that within 6 hours, your eyes are feeling pretty darn good after surgery. The eye is the fastest healing organ in the body. It's remarkable. I mean, you went in and had a surgery where there's maybe a small incision made. It doesn't heal in 4 to 6 hours, but the cornea does. By next day, patients are feeling pretty comfortable and seeing very well. It's pretty amazing. And we just encourage patients to do one thing. Don't rub your eyes. Don't try to traumatize the eyes. And that's after any eye surgery, LASIK, cataract, anything. And it's always a good idea to tell patients, don't rub your eyes anyway, because it's kind of tough on them. I think the ideal patient is someone that's dependent on glasses or contacts. Obviously, they're using an optical device to see better, and our goal with LASIK is to reduce the dependency on those optical devices. Vision is personalized. I love that about taking care of patients. I have to understand what your goals are, how we can help you see and try to match those expectations.
The main reason why I see patients, honestly, is what we call functional wellness. It's just the idea of the inconvenience of a visual impairment. This allows them to live life more freely, and they can accomplish the goals in their life with less of a hassle.
20/20 is kind of the standard, but there's some variability based on the structure of the eye. Some patients are not capable of seeing 20/20. And so 20 happy, it's a way we talk about things in the refractive surgery world. My 20 happy can be different than yours. That could be 2015, that could be 20/20.
How well you see depends on your optic nerve and your retina.
We see with our brain, so sometimes there's some variabilities there, but the goal is finding your personal 20 happy. The vast majority will achieve 20/15 in their vision, which is going beyond the standard.
We make the LASIK patient experience very simple. The best way to find out if you're a good candidate is to schedule a free LASIK consultation. And then if you're a candidate, you would then get scheduled for your surgery and then onto a follow-up.
For starters, probably 3 years ago, I came in, got evaluated. It was free, super easy, answered all my questions and kind of talked about financing and everything. Pondered it 3 years later, and I decided I was just ready to pull the trigger. So I got reevaluated, everything was still good to go. We got the date lined up, we did the LipiFlow. The day of was super relaxed. I was in surgery for probably less than 10 minutes. It was just shocking how fast it was. There was no pain at all. It just was pretty much look at the light, it's gonna go dark for a little bit, and then, all right, you can sit up and blink. And I was like, am I sure? Are you sure I'm good to blink? And they sat me in a chair and then waited for my ride to come get me. And then they took me home. I slept, I think, about 14 hours after surgery, just slept through all of it, woke up, and I could see significantly better right away. And then the very next morning where I came in and doc told me I had 20/15 vision, I just couldn't believe it.
Healing is 4 to 6 hours. There's been a little incision with a laser made in the cornea, the flap. That healing happens rapidly, but in the first 4 to 6 hours, we encourage patients to relax, maybe even take a nap to minimize that discomfort. The second is the flap adherence, and that really starts to attach itself and enhance very strongly in the first 24 hours, progresses to the first month, and that is really the stages that we go through. It's minimal discomfort, and most patients miss most of that. It's pretty amazing.
We care about our patients. We want the best for them. A patient like Blake, he was very happy after LASIK surgery.
Before LASIK, my prescription was a -4 or 2400, and then the very next day, my vision was 20/15. The more I continue through life without having to wear glasses or contacts, the more I discover how much of a burden they were, and then you discover something new every day of like, wow, I don't have to do that now, or I don't have to do that. I've had them since growing up, so this is my adult life now, not having to wear glasses and contacts. Glasses were kind of an inconvenience. You can't wear sunglasses whenever you want to, and then contacts were an inconvenience too because by the end of the day, they're getting dried out. Pre-LASIK, being a construction project manager, if I was going to be going to site, I almost wanted to pre-task plan that the day before, the night before, because I would want to wear contacts so that I could wear regular safety glasses, which is a required PPE, personal protection equipment. It was a hassle. Post-LASIK surgery, not needing glasses or contacts has been phenomenal. Waking up in the morning, just getting ready to go, being able to walk inside, coming from outside where it's cold and your glass is not fogging up, it's phenomenal. So I tell people, they're like, how's it been post-surgery? And I'm just like, quality of life's better this way and this way and this way. I chose to get LASIK at Dunes LASIK Center because it's proximity, and it also is where I get my primary eye care. I mentioned something about LASIK surgery and they had everything and all the information I needed to move forward with it. Price with LASIK, that's always a determining factor, but I was tired of spending money on contacts and glasses again and again, so I just didn't want to have to worry about glasses or contacts. I just wanted to be done with it. Did the math myself and figured that LASIK was the direction to go for me.
LASIK is cost effective. It has great value. All you have to do is look at traditional contact lenses worn properly and what the annual expense is, and do the math. We have a calculator on our website that shows you what your savings over time is.
Our lifetime savings calculator on the website compares the difference between glasses and contacts to LASIK. Patients are just amazed by the price difference that they'll save long term.
Often patients ask us, how do you determine your cost on LASIK? Because there is some variability out there. We want to make excellent vision accessible for as many patients as possible.
We offer a lot of payment options for our patients, so you can do out of pocket, you can use your flex dollars. Otherwise, we also have Care Credit, which offers a 24-month interest-free if paid in full.
LASIK technologies evolved, and we've currently been using what's called eye design. Eye design measures the eye very precisely, measures it more precisely than we can doing a glasses or contact lens prescription, which makes the outcomes amazing. It's a common and current technology used by top centers across the country, and we've had great success utilizing it.
Eye design is a very unique technology. Not only does it use your glasses prescription, it also collects over 200 data points through their wavefront technology. It is completely customized and personalized to each eye individually.
Most of our patients come from other patients. It's our number one source is referrals from other patients, and that speaks volumes to us.
I would recommend Dunes LASIK Center, absolutely. From the moment you walk in, you feel comfortable, you feel confident. I've been wanting LASIK for a long time. I got corrective lenses in high school and I was in sports, I wanted to go swimming, I was active. Vision problems just really was a difficult thing to experience. They wanted me to wait to get LASIK because they wanted to see if my vision would change. So finally, over time, my vision was getting worse, but it's kind of stabled out at like -5, and then I had an astigmatism in my right eye. They said at this age I would be a good candidate to get LASIK to correct my vision. One of the challenging things about being a teacher and needing vision correction is you'd come home at the end of the day with a blinding headache. And LASIK has really helped me not have headaches anymore. It's cleared up. I feel more energized at the end of the day. My eyes aren't tired. They used to be very scratchy and itchy and dry, and LASIK changed all that. LASIK has changed my world. I can see a poster across the room where before that was just not something that I could do even with glasses. And I think it lets my personality show as a teacher. I feel like I'm not hiding behind a lens. I have so much more that I can do as far as activities. I love to take my son to the pool. We go outside. I don't have to worry about something getting into my contact. I just go. They wanted to really make sure that my tear film was healthy, and I didn't know anything about tear film before I talked to Dr. Ferguson. It was impressive that they wanted to make sure my eyes were healthy before they could do the LASIK procedure, and they really let me take the time to have that tear film become as healthy as it could be.
The number one side effect that can be induced is dry eye. Therefore, it is critical that we evaluate the surface and treat the tear film ahead of surgery. That has been one of the biggest things that we've changed in how we do LASIK in the last decade. Stop side effects from happening. We pre-treat almost every single patient to prevent that effect, And we just generally are not dealing with the problems of dry eye that sometimes other centers have to if they are not paying attention to the tear film. It's critical.
I trust him, yeah. I trust Dr. Ferguson with a procedure like this, and they took the time to educate me about my eye health and made sure that I was ready to go for the procedure. I chose Dunes LASIK Center because of its quality, reputation, and its convenience, and the location is easy to get to. I knew that LASIK is not something that everyone can do. The price definitely is worth it for the quality of living that you get with LASIK treatment. I used the online savings calculator and saw that I would save over $20,000, and that was an easy decision to make. When I talked to Marcy for my free consultation, she was very transparent about the cost. She broke everything down for me from my LipiFlow to the actual LASIK procedure. There were no surprises with any costs, and I was very well prepared. After my LASIK procedure, I went home, I took a nap, I wore goggles just to make sure that my eyes were safe as I slept, and the very next day I woke up and I drove myself to my post-op appointment. My vision after LASIK is 2015. Every day I wake up just thankful that I don't have to spend a long day wearing contacts that I know are going to be itchy by noon and dry. I make sure that my eyes are still healthy, but I don't have to worry about contacts, further damaging my eyes.
Contact lenses do carry some risks that are more amplified than LASIK surgery. And some patients put themselves more at risk wearing contact lenses, and we don't think about that. The unfortunate thing about contacts is they're being treated more as a commodity than a medical device, which puts them a little bit more at risk.
After LASIK, I realized how much of a pain contacts and glasses are, and I don't have to use them anymore. If I was talking to someone who was considering LASIK, I would say, go for it. Oh my goodness, it will change your life.
I tell patients this sometimes. It's not bad getting old. I've been around the block. I've seen a lot of things. I've experienced changes in technology, and Dunes LASIK is no different. We launched this over 20 years ago, and we've developed a reputation to be a center of excellence and applying appropriate treatments to patients that are good candidates.
We have a deep passion for vision correction surgery.
It's really amazing. We get to see the patients before and after their surgeries. It's really exciting just to see them come in the very next day without glasses, without the need for contacts.
LASIK is a phenomenal surgery. I've had it done. If you look at a study, there's more refractive surgeons who had LASIK done than the general population. Ophthalmologists like me who do vision correction surgery, if we did not truly believe in the technology, we wouldn't do it to ourselves.
I'm very excited that Dr. Thornton has joined us. She brings experience, trained at Cincinnati Eye with Dr. Holland, who's one of the foremost corneal specialists in the United States. I've worked with some great surgeons. We've only had outstanding surgeons here, but she's unique. It's watching her interact with patients before surgery sets her apart, and I think it gives us something we've never had in the past, and I'm extremely excited about her as an addition to our team. She's generally interested in what they are trying to accomplish, and it's just a kind of a really refreshing type of an approach that I really like. You don't become an expert without experience, and she's got tremendous experience. She's done LASIK surgery for years and years. She does research, she's lectured, she's an expert for industry, which you cannot replace. You cannot replace training and experience. How we stand out from other LASIK centers is experience.
Having a deeply experienced team brings a level of comfort towards patients that they will not be able to experience elsewhere.
Everybody on our team throughout our clinic understands how LASIK works, the importance of it, and how to help take care of patients. We're cross-trained, and I think patients, they see that. They really feel it when they walk through the doors here. We just love taking care of patients.
It is just a life-changing surgery that I would recommend for anyone who qualifies.
The proceeding was a paid promotional announcement for Dunes LASIK Center in Dakota Dunes. See the world clearly and free your face. Visit duneslasik.com or call to learn more.